I get a lot of questions from patients through my website, and Barbara is going to go through some of these with me now.
Okay, our first question is from Matteo. He's 54 years old and is asking if derma filler works for hollowness jawline definition. We get this a lot from a lot of guys. I'm seeing things along my jawline that I hate. Also, I see that under, not on my cheeks, but under my cheeks is hollowing. Can this be fixed?
So I've actually got a patient exactly like this at the moment, and what they have is a hollowing here, and a loss of definition here with some chin protrusion. So the approach has been to use a little bit of filler in the deep plane to just give some impact back to that hollowness, but really to focus really on jawline definition and, in his case, some chin projection, because we tend to lose support around the chin as we get older. The trick is not to put too much filler into that hollowness, because you can end up looking like a chipmunk or exploded cheeks, which in a man is not a good thing anyway. So in a man, we tend to have a much more angular face with less volume in the cheek. So we're using very small amounts here in the deep plane, a little bit on the superficial plane. So we're using a sort of sandwich technique or a combination technique, and then some different techniques down here to contour and also stop muscles pulling things down.
Is that just a male problem, or do women have that as well?
Women get it too, yes. So it's a similar way of looking at it. But again, I just mentioned that the women tend to have more cheek and they're more curvy, and they're less angular. So you're going to compensate for that accordingly. You can use more filler generally to enhance this cheek around this area here. You probably don't want to do in the male.
Okay. Yeah. All right, that was a good question, Matteo. Rebecca is 52 and is wondering, where is the best spot to inject to smooth out nasolabial lines and marionette lines? I've heard some inject the cheek area and not directly on the lines to avoid a monkey look. It's the first time I heard that, a monkey look. I want to smooth out my face without looking puffy. I don't want a lot of fat in my cheek, which probably makes it look even worse. How do you avoid hitting arteries, and what type of filler would you use? And any advice would be appreciated. So you could just give her some direction.
Okay, so nasolabial folds are these lines here, or folds here, and marionette lines around the mouth, really running down this sort of area as well. The way to approach that is not actually to use filler into these folds, because you will create that chipmunk or monkey look, but you're really looking to lift. So it's not about volume, it's about lift. And we're trying to restore what's actually happened, which is descent from the mid-face. We use fillers around these areas for marionette lines, but they're very light. They're like a skin booster type of filler. So you're not going to want to put any volume there at all. That's really about hydration more than anything. And up in this area for treating these folds here, it's all about the lift aspect. The fillers vary, and we have very light fillers, we have very thick fillers. And I think it comes down to assessing that the patient, they're all very different, and you have to find the product that's suitable for them. Typically, if we're using lifting fillers, we're using the volume type fillers. And if we're using around here, around the mouth, we're using the very light fillers. And the last part of the question, yes, there are arteries to be careful of. There's the facial artery around here, running down here, and there's the transverse artery here. So, and there's the labial arteries around the mouth. So yes, you do have to know your anatomy, you have to know which depth you're going, and just be very mindful of the safe zones and the danger zones.
Okay, so you should do your research, have a consultation, and look for a qualified, certified doctor.
Yeah, I wouldn't, personally, I wouldn't want anyone to be injecting to my face that doesn't know what they're doing. And that does require expertise, and that requires an understanding of the anatomy.
Okay, good advice. Our last question is from Phyllis. She's 61 years old and is asking which treatment options would be best for targeting dimpled and loose chin skin.
Dimpled chin skin, so around here. So dimpling of the chin can be caused by a few things. One is the muscles being very active. So we can use Botox to treat a dimpled chin if that is appropriate. You can also use, I touched on it in the last question, that you'll be using very light fillers typically to hydrate the area. The skin is usually crepey, thin. So we're looking to use much finer fillers to restore that that look, that get rid of that crepiness. Yeah.
Okay, well, that's our last question.
Thank you very much. If you have more questions, please go through my website and submit them on the email. Thank you.